Hey everyone, Debbie Reed here, Think Healthcare Solutions, Trust About Healthcare on the Healthitude Academy. This is episode 19, Ask a Frustrated Nurse, update to the news and the clues of what's going on in our healthcare world. Not a lot to report today, coming off of my last episode talking about the 200 doctors leaving HCA there in North Carolina. Probably a few more. I know of employees that have been with HCA. In fact, one of the facilities where they were employed got bought back by HCA, and they've since left to other opportunities. So I'm not sure what's going on with one of the bigger groups. I just think my personal opinion is when you're taking on more, more is not always better, and until you bring in and maintain quality, having a whole bunch, they've got so many new projects. I stand amazed that everything is going, and not surprised at the concerns that came across there at the Mission Hospital there in North Carolina. To add to other news, a facility in Florida, Jacksonville, Baptist Health, put the first new atrial fibrillation device in the area. First in the region to implant a new atrial fibrillation device. Not surprising. Washington Hospital may change name of maternity center to be more gender inclusive. Ten hospitals seeking CFOs. I'm not sure. Let's see. That's today's news. That happens quite often, but it's kind of interesting when they start, Casper, Wyoming. It's all over the country. There's a few in Indiana, a hospital in Bakersfield, California. Roswell, New Mexico is looking for a new CFO. That's not uncommon to see happen, and it's a list of 10. The other thing, where was it? California Hospital is going to have a one-day strike regarding their staffing concerns. 16 hospitals looking for chief medical officers, which I opened that article and I was expecting to see a few more HCA facilities, and I didn't. I was kind of surprised. One of the news flashes in one of the new articles hitting the hospital storyline is potential dock workers' strike could aggravate U.S. supply issues. Talking about supply shortages, which may lead to higher prices for consumer goods. Now, I wouldn't be surprised if hospitals didn't try to raise their prices. There are certain things and certain ways that they are supposed to raise prices. Having said that, I would not be surprised if some didn't try to figure a way to get around that. Now, On some happier news and on a positive COVID news, there's an article that was posted today that says 730,000 nursing home residents have recovered from COVID. And this came from not the CDC, but the, get to it, but the American Association of, what is it? Nursing homes. Oh, American Healthcare Association and National Center for Assisted Living is where that report came from. Long-term nursing home residents saw 15% fewer hospitalizations during the pandemic. Short-term residents are seeing an 8% functional improvement during COVID. 72% of more than 110,000 infection control focused inspections of nursing homes conducted in from 2020 to 2022 were deficient-free. Nearly 60% of nursing home residents' COVID-19 deaths occurred in the first 7 months of the pandemic. And the risk of COVID-19 mortality for people 85 years and older is 340 times higher than those 18 to 29 years old. High spread in the community is often correlated with outbreaks in nursing homes, and residents were 4 times less likely to succumb to COVID-19 during the Omicron surge compared to the height of the 2020 surge. There you have it. That's not something that they will let you know. So, on that note, I'm going to close with as a positive one that there is some positive reporting out in the world, and please stay tuned for more honest answers as regard to your health care.